gynae patient. So as you all know, for gynae patient, it's going to be almost the same with normal other system examination, except for the IPPEC is the same, except for the position and exposure of the patient. For the position of the patient, it actually depends on the region where we want to examine the patient. Like firstly, for the general examination, then we will ask the patient to lie down. So we examine everything, and then after that we need to change the position. So I'm going to start with the general examination first, and after that, as I present the rest, I'll tell you how we change the position and the exposure. So we ask the patient to lie down. Okay, and then the exposure, normally for gynae patient, we need to expose the patient starting from the nipple line up to the mid-thigh. However, today in this patient, I'm going to that is for norm lah. Then if you want to examine the patient, if you are not going to do, you are not going to expose the patient like that, then you need to explain to your specialist during examination that you are going to expose the patient starting from here to here. Like today, I'm going to expose the patient from bra line up to the suprapubic area. And then you need to remember, whenever you want to inspect the patient, try to expose a little bit of suprapubic area. Okay? So you make sure the patient is comfort, and then you start with general examination. Like you all know, the inspection, you can inspect the patients from the table, okay, on the feet of the patient, or to patient's right. So like the rest of examination, PCLC, PR, HNG, and NA, the same thing, except but today I'm going to just touch a little bit on which one you should pay more attention. So in gynae patient, you need to see the color of the skin, whether the patient is pale or not, because normally for gynae problem, it's normally associated with menorrhagia or menometrorrhagia. So you need to check whether the patient is anemic or not. And then check for jaundice, the same thing, the color of skin and also sclera. And then smoke stained fingers. This one normally is if the lady smoke, then you can actually see whether she's lying or not, or maybe the gynae problem is actually associated. The risk of the gynae problem is from maybe smoking. Okay, and then obesity and excess and hair distribution. Hair distribution is normal. However, if it's excessive, then meaning it's pathology for normal women. So if obese or hirsutism, normally this we can suspect in PCOS patient, polycystic ovary syndrome. Okay, and then extreme thinness, like suddenly the patient comes and then you see that the patient is very cachexic. Then this one we can suspect in patient having any malignancy. And then you check for ankle swelling, whether it's unilateral or bilateral. And then you do other general inspection, starting from the chest, abdomen. The chest, you need to pay more attention on the mastectomy scar, the respiratory rate, and then the heart rate. You see whether the patient is tachypneic or not. And then for the abdomen, this is the main important things in gynae patient, because normally if presence of pathology, normally you can actually see in the abdomen. So you look at the abdomen, you inspect the abdomen, you see whether the abdomen is distended or not to suspect any mass. So and then any obvious scar like snap, phalangeal scar. That is lower cesarean section scar. And then any appendectomy scar, cholecystectomy scar, and so on. And then presence or not of cutaneous sign of pregnancy, the linea nigra and striae gravidarum. That one, if let's say there's a mass, you want to exclude whether she's pregnant or not. So you need to inspect the cutaneous signs. And then when you inspect, you look at the umbilicus, whether it's centrally located or not. If the umbilicus is not centrally located, meaning might be there's ovarian mass which will shift the umbilicus to the other side. Okay, and then rest sometimes you need to ask the patient to do cough test to check for hernia. So you ask the patient to cough. During coughing, you look at the abdomen. If presence of hernia, then it will be bulge lah, kan? Okay. And then no color changes. And then peristalsis, check for peristalsis presence or not. And then ascites. So that is the main important things in getting patient for inspection. And then you continue with the palpation. For palpation, like the rest of the examination, you do everything, the chest, the palpate, vocal parameters, whatever, apex beats, and then you continue with the abdomen. The main parts of abdomen, you palpate, you do the superficial and deep palpation. Like the one in the 9 quadrant thing. And then normally in superficial palpation, you cannot appreciate any mark because this one is like slightly, so you cannot feel the mass. So normally for superficial palpation, it will be soft and non-tender. However, when you continue with the deep palpation, then only you can appreciate the mass. You do the same thing, the palpation for liver, the spleen, kidney, not specifically to for uterus and ovaries, but when you do the deep palpation, you can actually feel the mass in the uterus region and ovary region. Like for example, if I palpate the mass, let's say in the right lower quadrant, the deep palpation. So you look at the patient's face, you can see that the patient is having pain, tenderness. So you can suspect maybe there's ovarian mass. Because normally for this one, you cannot appreciate you cannot really appreciate it. Only by manual, only that you can suspect. And then in abdomen, you check for any signs of peritonitis, any distended vein, you do the palpation. And then one more thing you need to remember, whenever you suspect ovarian or uterus mass, when you want to describe the mass, one of the criteria is you can go down under the mass or not. If you can go down under the mass, might be the mass is coming from the origin is from the ovary. However, if you cannot go down the mass, meaning it's uterus, the origin is from your uterus. For example, like fibroid, adenomyosis, whatever. Okay. And then when you palpate, let's say you palpate, you feel suprapubic mass, and then you need to measure starting from the let's say this is suprapubic region, right, mons pubis. The center of the pubis, mons pubis, go up to the border of your mass. Let's say you palpate, and then you feel your mass is here. So starting from the suprapubic area, then you measure up to the border of the mass lah. And then you estimate the size from the gravid uterus. For example, like mass is palpable at the suprapubic area, measure approximately 20 weeks of gravid uterus, something like that. Okay. And after that, you continue with the percussion and auscultation. Auscultation, as the rest, you check for bruit in abdomen. and the rest of the